Hi Kendra, how are you doing today?
I'm good. How are you?
Good. So I'm just going to tell you a little bit about what I do. I'm a genetic counselor, so I'm just going to go over some of the results that you got from that testing you did with your doctor. But before we get started, can you just tell me a little bit about what your doctor told you about that testing?
My doctor didn't really explain it that much to me. They just said that they were going to do a blood draw and it was some type of genetic test. And I saw the results in my chart, but he didn't really explain it to me. But I looked up what it was and it's sort of scary. So that's
Yeah,
where I'm at.
yeah, it can be intimidating to kind of, go and Google and see all of those results come back. But we'll talk through all of that today, and hopefully make that give you a little bit of clarity on what all of those things mean. Do you have any
Mhm.
questions for me before we get started?
Not yet. No.
Okay, all right. So the testing that they did, you're right. It's basically looking at your blood, and in your blood you have your cells, but you also have some cells from baby. So basically, some of your cells that are in the placenta, they're gonna like slough off into your blood, and so a percentage of those cells are gonna be from the placenta from the baby. Does that make sense?
Yes.
Okay. So what we're looking at is those placental cells that we're seeing in your blood. So this test is really good at picking up if there's any changes in chromosomes. So what's your familiarity with chromosomes and science?
Not the most. I know we all have genes and stuff, but I'm not too familiar with what chromosomes are.
So basically, the chromosomes are the packaging units for those genes, basically. So that's how it's all wrapped up in each of your cells. And those genes are going to code for kind of like a blueprint for your body. So if we have too much or too little, it can cause issues. So that's really what this test is looking for. It's looking to see if you have missing or extra chromosomes, which might cause issues in baby. Does that make sense?
Yeah, so if baby has more chromosomes, then they might have some problems. Is that what you're saying?
Yes. Yeah, they
Okay.
have a little bit extra material that's going to cause issues. That's exactly
Okay.
it.
Think
So
yeah,
yeah,
that makes sense.
yeah. So we're looking to see if that's the case, and this test is really good at picking up that. But there are some limitations to this test. It's just a screening test because, like I said, it's looking at those placental cells and not directly at baby themselves. So we might be picking up on a change that's in the placenta, but not actually in baby. Um, we also might just be picking up on a change that's in some of your cells. So those are some of the things that we want to think about when we're looking at these results, because that might mean that it's not as accurate as we think it is. So those are kind of the limitations of this test. But we also did your anatomy scan and we saw um, a something called a stop sign, and that just means that basically it's something that's not wrong with baby. It's not going to cause any issues, but it does increase our suspicion that the test result that we saw was correct. Did your doctor explain to you at all, like what that ultrasound finding was and what it means?
No.
Okay, so yes, we saw the choroid plexus cyst, and that's one of those stop signs. That's just going to tell us that that's something that we often see in these babies with this condition called trisomy 18. So that's increasing our suspicion that what we saw on that screen is true. So trisomy 18 is basically a condition where you have an extra chromosome 18. So I'm just going to share an image with you to help you visualize this. Can you see that?
Yes, I can.
Okay. So this is what your chromosomes look like. You can see you have, normally we have 46. So we're going to have a pair of each chromosome, and there's going to be 22 that are just our regular chromosomes, and then you have two that control your sex. So in males, it's going to be one X, one Y, and then in females, you're going to have an X and an X. So what we're seeing that's different is that this test was picking up on extra chromosome 18. So as you can see, for kids with trisomy 18, they have this extra copy of that chromosome. Does that make
Okay.
sense?
Yes.
Okay. All right. Let me just stop sharing real quick. Okay. So um, we can go through and just talk about what the features are of this condition and what it's going to mean for your pregnancy. But before we do that, we can just talk about what the risk is that this result might be correct. So typically, when we're looking at one of these results of the test that you did, the chance that the result is actually correct for your age is going to be about 17%. But since we do have that ultrasound result, we are highly suspicious that it is correct. So just I want to keep that in mind as we move forward. So yeah, you have any questions?
Yeah, so when you say 17%, what does that exactly mean?
So that means that let's say we get a positive result back. The chance that that positive result actually means that baby has the condition that was screened for is 17%, given your age and other factors.
Okay, that makes sense. Thank
Okay.
you.
Yeah. So that's what we would initially think if we're getting that result back. But because we also have that ultrasound finding, our suspicions increased.
Okay.
Yes.
Okay, that makes sense.
Okay. Awesome. So are you okay with moving into just talking about what trisomy 18 is?
Yeah, that would be helpful because
Okay.
also I know you talked about the choroid plexus cyst, but I don't really know what that means. But what are other things that I should be like thinking of like the rest of my pregnancy, which I think you're going to talk about. So,
Yeah, certainly. So as I said, the choroid plexus cyst is just kind of um, not something that is going to cause any issues, but that's basically just showing us it's something that we see often in these children. So it's a buildup of fluid that really isn't problematic, but does indicate that we're more suspicious. Does that clarify that a little bit?
yeah,
Okay.
thank you.
And then as far as children with this condition, a lot of the times these children do have a lot of birth defects. So often they will pass away in utero. We don't see a long lifespan with most of these children, um, which I know that can be a pretty intense realization. I'm sure that you saw that when you were doing your Googling. But we do see that 50% of these children do make it to their first 2 weeks of life. Then about 5 to 10 will live past their first year of life. Is that about what you saw online?
Yeah, that's unfortunately what I was seeing too. So,
And I understand that that can be a pretty heavy burden to just, think through, especially, since you've had some successful pregnancies previously.
yeah, it's just something I wasn't expecting because yeah, I have two other children and this hasn't ever come up before. So,
Kind of a shock.
yeah, yeah, definitely.
Hmm. Yeah, no, I understand that.
Mhm.
Um, well, we're going to talk about, what your options are and what we can do moving forward to just get ahead of the game and help prepare. Um,
Yeah, that would be great. I'm
okay.
I'm more of like I'm very information seeking, so
Mhm.
anything that you can tell me, I really appreciate.
Sure. So some of the things we can expect to see, um, as I said, some of those birth defects. So over 50% of these children are going to have a heart defect at birth. So that's something that we might expect. You're also going to see some issues with your GI system. So there's something called an omphalocele that we might see. That basically just means that baby's GI tract is in kind of like a sac outside of their body. This is something that can be put back in and corrected. So that is something that can be surgically fixed. There's also, we might see kidney problems. One thing that commonly occurs is something called a horseshoe kidney. So this just means the two kidneys are kind of stuck together in a horseshoe shape. So those are some examples of some of the birth defects we might expect. Baby is also likely going to be small. We do see that these babies are often restricted in their growth while they're in utero. And then if they do survive past a certain point, we typically see some intellectual disability, breathing issues, trouble with feeding, and they often have some distinct physical features. So we might see that their hands are clenched in balls, and that their feet have a distinct shape. So those are just some of the things we might see after birth. Does all
Mhm.
that make sense?
Yeah, what do you mean by a distinct shape of the feet? Like, do they still have feet, or is it like are they missing toes or something? Or
Yes, no, it's basically just the back of the foot. It's kind of going to extend past where the normal heel would go. So we,
okay,
yeah, we call it a rocker bottom. So it kind of looks like, you know, a rocker on a chair, just extending a little bit farther back than you would expect.
okay, that helps. Okay.
Yeah, sure. So I know that all of that can be really intense and, you know, a lot to think through. So there are some referrals I can make to help you talk through that a little bit more. Some of the people that you might want to see are neonatology. Those are the individuals who care for preterm infants. So they're in charge of some of those more intensive interventions after birth. Another specialist that can be really helpful is pediatric surgery. They can help fix some of those birth defects that I talked about. And then palliative care, they're kind of your comfort care. So if things um, are more severe, then they'll just kind of help make sure baby is okay and passes in a comfortable manner.
Okay.
So, you know, we can talk through that a little bit more if you want. But right now, we don't have that definitive answer. So, if you're interested, we do have further testing that we can do to kind of clarify whether or not the tests that we're seeing in the ultrasound or the screening results that we saw in those ultrasound findings are correct. Would you like to talk through those options a little bit?
Yeah, what other testing is there?
So, one thing that we can do is something called an amniocentesis. It's a pretty common diagnostic test, so that will give us a yes or no answer. Have you ever heard of that?
I've heard of it.
Okay. Yeah, it's fairly common. Basically, what this is doing is inserting a needle into your abdomen and just extracting a little bit of amniotic fluid, which is the fluid that's around baby. And that fluid has baby's DNA. So that's why it's diagnostic. It's going to tell us exactly what's in baby. And we're going to look at that and basically just look at baby's chromosomes and see if we're counting the right number or if we're counting an extra 18. Does that make
Okay.
sense?
Yes. And I mean, I want to know that information, but having the needle in my stomach makes me a little bit anxious. Like, how do they know they're not going to like poke the baby?
Well, our MFMs are very experienced in this and they do these routinely. So it is very common, but there is a risk of miscarriage. We quote that risk to be about 0.1% or 1 in 1,000. So if that is something you're concerned about, then you can opt out of that. That is not a required test. It's really just if you want to be sure. There is another option if if the amniocentesis sounds like a little bit too intense and too scary, we can also test your chromosomes. And that would just give us a little bit more clarity because remember if before I talked about how we it might be something that we're seeing just in some of your cells. So maybe just in a couple of your cells you have that change and that's what we're picking up on. It could also be that it's the placenta or fetus. So we can't rule out that it's from the placenta, but we could rule out that maybe you have just very few of your cells that might have this change, and that's what we're picking up on instead of from baby. Does that make sense?
Yes. So there's the chance that this could be something coming from me, but not all of my cells are affected, is what you're saying, if that were the case.
Yes. So
Okay.
that's a less likely case, but if that would help give you a little bit of clarity, we could do that testing just in case.
Hmm. Okay. Yeah. I think thinking about it, my husband and I, when we looked up all that, when we were Googling everything, amnio did come up. I didn't really know what it was, but your explanation is definitely gave me more like insight to what it actually is. And we really just want to know if baby is affected with this. So I think amnio is something that I would do.
Okay, certainly. Well, we can talk after this session. We can go and talk and see if they have a time that they can schedule you in. Um, so yeah, we can certainly have that done. And once those results come back, I will call you with the results before they go into my chart, and you just get that. Um, you can look at that. I'll go ahead and give you a call and tell you what those results are, and we can just talk through kind of everything that we talked through today a little bit further. Does that sound good?
Yes. Yeah,
Okay,
I'd appreciate the call.
certainly. Okay. So another thing that if you are interested, there is an organization called SOFT, and if you feel like that might be helpful, they are support organization for trisomy, and they have some really good resources just to help go over everything that I talked about today and give you some more perspectives. Um, if that's helpful, I'll include that in all of the paperwork that I send you, just so that you have a little bit more to look through if you have any more questions.
Okay. Yeah, no, I would definitely be interested. Is it just for trisomy 18 or are there other conditions like trisomy 18?
Yes, so the other condition that they look at is something called trisomy 13. So it's basically the same thing, but just for the chromosome 13, there's going to be an extra copy of that chromosome. They
Okay.
also are do triploidy, so that's basically when you have an extra set of chromosomes. So all of your chromosomes have one extra. That
Okay.
organization kind of looks at all three of those.
Okay. Yeah, no, I think that'd be good information. I would like to have that.
Yeah, I think it's always helpful just to see other perspectives.
Mhm.
All right, so just the last thing I really want to do is get some of your family history, make sure that's all updated. So I'm just going to move into that real quick, and then we'll get you scheduled for that amnio.
Okay. That
All
sounds
right,
good.
perfect. So you are 34, correct?
33.
33, okay.
Birthday's in December,
Ah,
but
gotcha, yes.
Mhm.
All right. Um, do you have any children?
Yes, I have two kids.
Okay. And boy or girl? Boys or
Two,
girls?
gir- two
Two
girls.
girls. Okay.
Mhm.
Do they both have the same father?
My two girls do, yes.
Okay. And this current pregnancy also the same father?
No.
No? Okay. How old are your girls?
My oldest is 10 years old, and then my other daughter is 6 years old.
Oh my goodness, just started first grade.
I know. I can't believe it. They're really growing on me. Yeah.
Time flies.
hmm
All right. Did either of them have any issues during pregnancy? Did you have any issues during your pregnancies with them?
No,
No?
nothing that I remember. That's why this was like such a shock.
Yes, I can imagine, especially if those went smoothly. You don't expect it, yeah. Did
Mhm.
they have any birth defects or anything notable at birth?
No,
Okay.
they're granted, labor isn't the easiest thing, but yeah, they were okay.
No, I understand. Okay, well, we'll start with your side of the family, um, and then we'll move on to their father or your baby's father side of the family.
Okay.
So, do you have any siblings?
Yes, I have one brother.
Okay. And how old is he?
He is 30 years old.
30. Okay. Does he have any children?
No.
No? Okay. And your parents, are they still living?
My mom is not.
I'm sorry. What did she pass from?
Suicide.
Okay. Sorry to hear that.
Yeah.
Um, so how old is your father?
He is 55.
All right. Does your father have any siblings?
No, he does not.
No? Okay. And your mother? Did she have any
No,
siblings?
she's an only child too.
Okay. All right. On that side of the family, did any of your, either of your parents or your brother have, intellectual disability or any, issues at birth with, sorry. Did either of them have any issues at birth, with any complications during pregnancy or anything like that?
My brother has intellectual disability, like mildly.
And is he able to, keep a job, live alone?
Yeah. Yeah, he's pretty like high functioning. Sometimes he needs help with certain things, but
Okay. Did your mom ever lose any pregnancies or have any miscarriages?
not to my knowledge, no.
Okay. And no birth defects that you know of?
For my mom.
On that side of the family, that had any birth defects, such as a clubfoot, a heart defect?
No, not that I'm aware of.
Okay. All right. So we'll move on to um, baby's father's side of the family. So for your current pregnancy,
Okay.
um, all right. So is baby's father still living?
Yes, he is.
Okay. And how old is he?
28.
28? Okay.
Mhm.
Does he have any children from other relationships?
No,
No? Okay. And does he have any siblings?
no.
Okay. You know if his parents are living?
I do not. I don't really know that much about his family.
Okay. No
Unfortunately,
worries.
I didn't think to ask him before I came to this, but
That's okay. If you just in an overview, like if you can think of anyone that he's ever mentioned that had any intellectual disability or birth defect, it's okay if not.
yeah, I'm unsure.
Okay,
Sorry.
no worries. That's all right. Okay. And just some general questions that we ask to everyone. Um, any sickle cell in the family?
What's sickle cell?
It's a condition that's often seen in African American populations that has basically a blood condition. If you don't know, then probably not, so no worries.
Yeah, no, no one in my family at least has ever had any issues with blood or bleeding a lot or anything like that.
Okay. Um, and then any Ashkenazi Jewish heritage?
Mm, I let me think because I know my grandma was Irish. Um, hmm. Thinking, sorry. I
No,
did
you're
the
fine.
ancestry test.
Okay.
But I can't exactly remember. I think my mother's side of the family came from Ireland, so I guess Irish, so not Jewish, no.
Okay. And do you know the baby's father? Do you know if he what his family's kind of from, where their ancestry is?
Um, hmm. Trying to think. I don't think so.
Okay, no worries. Um, do you Is there any possibility that you and baby's father are related?
No.
Okay. And any history of cystic fibrosis, spinal muscular atrophy?
I've heard of cystic fibrosis before. I haven't heard of the other one, but I don't remember anyone in my family talking about that.
Okay. Yeah, cystic fibrosis is just going to be that condition where you're going to have, some lung issues, maybe some issues with digestion. If none of that sounds familiar, then probably not. And
Mhm.
spinal muscular atrophy is going to be more of a muscular issue. So anyone who has issues moving around might be someone that you might consider. But if none of those sound familiar, then I would assume not.
Okay, yeah, yeah, that makes sense.
Okay. All right. And then has anyone in your family ever had genetic testing?
Um, I don't think so.
Okay. No.
No.
All right. And then just real quick, I'm gonna recap your pregnancy, just see if make sure we have that all down.
Okay.
Um, so when was your last menstrual period?
Oh, that's a great question. Um, you know, I'm trying to think. So if I'm 18 weeks along, that's like around 4 months ago. So sorry, I'm doing the math. I should know this. I would say probably in December, sometime
Okay,
in around there.
yeah, that's good. And the baby's at 18 weeks, right? And when was your last ultrasound?
My last ultrasound was when I first came to the OB, so that was probably, I didn't come until I was about, I would say, maybe like 10 weeks.
So you had one
Uh,
around then.
yeah, and then I had the one recently, because
Mhm.
I came in for like my early anatomy
Yeah.
scan, and then that's when they saw that cyst that you were talking about.
All right. Have you already had any bleeding or spotting?
No.
Okay. Any leakage of fluid?
Mm-mm.
Okay. Any infections or fevers?
Thankfully not, no.
Okay, that's good. Any hospitalizations or x-rays done? No. Okay. Are you on prenatal vitamins?
No.
No. Okay. Are you taking folic acid or vitamin D?
No.
No. Okay. And do you have any medications that you're on currently?
No. I'm not
Okay.
taking anything.
And then any smoking, alcohol, drug or use or exposures at work
For
while you've
myself,
been pregnant? Yes, while you've been pregnant.
no.
Okay. All right. All right, so that's all I need for your history. So as I said before, I'll go ahead and make those referrals for you, and we'll go ahead and set up your amniocentesis. Um,
Mhm.
and I will send everything that we talked about today to you in a little letter, including that resource that you can check out, Soft, just to give you a little bit more information. Do you have any last minute questions for me?
Um, when I do the amniocentesis, when would I get when would you call me with those results? Like how long does the test take?
So it's going to take about 2 to 3 weeks to come back. So I will call you after that's done. But we're gonna do a preliminary test, and that should only take a couple of days, like 2 to 4 days. So I'll call you with those preliminary results, and then we'll just kind of have that confirming results later on.
Okay, so is the preliminary result sort of like, is that sort of like it gives us just some more information and
Yes.
then
Sorry, go ahead.
can you
Hello?
hear me?
Yes.
Okay. So the first result, 100%. like the result?
Yes. So that first result's just going to be kind of giving us, it's basically going to, it's this thing called FISH, and we're just going to tag the chromosomes and see if we're seeing an extra little probe that tells us we're seeing another 18. So that we can be pretty sure that that's correct. But what we really want is a picture of the chromosome so we can check and make sure that everything's where it should be. Does that make
Okay,
sense?
that makes sense. Yes, thank you.
Yeah, so I'll call you in a couple of days after your amniocentesis to just kind of go over the results.
Okay, that sounds good.
All right, great. So we'll go ahead and schedule your appointment.
Okay, thank you so much.
Sure. All right. I'm gonna